Assalamu alaikum. Gestational diabetes is one of the most common conditions that impact pregnancies in Qatar. 1 in 4 women will develop this condition. Gestational diabetes is mostly caused by increase in body weight before pregnancy, and excessive increase in body weight during pregnancy. Gestational diabetes does not cause any symptoms. The only way to discover gestational diabetes is through regular screening. And we're lucky enough that we have a national screening program for all pregnancies to detect gestational diabetes. As I said before, gestational diabetes is caused by increased body weight. But the good news is gestational diabetes is preventable. Reducing the weight before pregnancy and avoiding excessive gestational weight gain in the first 20 weeks of pregnancy can prevent gestational diabetes. Hence, we will advise every woman to know exactly how much weight she is supposed to gain before she gets pregnant. Gestational diabetes negatively impact the pregnancies and impact the mother and the babies. The mother is at high risk of developing high blood pressure, developing preeclampsia, end up delivering early, and end up with cesarean section, while the babies are at high risk of becoming quite large in size, and that can make the delivery quite difficult or increase their chances of having injuries to their shoulders or arms. Babies who are delivered early are at high risk of developing chest breathing difficulties and at high risk of having low blood glucose, which might require them spending a few days in a special unit. The impact of gestational diabetes extends beyond pregnancy. 1 in 2 women with gestational diabetes will develop type 2 within 5 years of delivery, and 1 in 3 babies will develop type 2 diabetes by the age of 35. The most important intervention in gestational diabetes is actually diet and exercise. We don't mean or intend to starve women. We actually draft meal plans and dietary plans to avoid the women with all the important nutrients that she requires in order to have a healthy pregnancy. The meal plans, the amount of food is actually spread equally throughout the day in order to avoid increases in blood glucose. Exercise is very critical and important during pregnancy as well. 30 minutes of exercise goes a long way. It improves the body response to insulin, and that will improve the blood glucose for up to 24 hours. Brisk walking is actually quite enough, whether it's done inside the house or whether it's done outside the house. Regular monitoring of the blood glucose is very, very important, knowing exactly what targets you're supposed to achieve. And if the woman cannot achieve her targets within 2 weeks of starting diet and exercise, then she will require to go on treatment, whether these are forms of tablets or injections or a combination of both. Regular monitoring of body weight, regular monitoring of blood pressure, regular monitoring of the baby growth is actually quite critical. Perhaps the most important thing as well after delivery is for women to take steps to reduce the chances of progressing to type 2 diabetes. Body weight loss, or reducing the body weight between 5 to 10% within the first year of delivery, will reduce the chances of progressing to type 2 diabetes. Regular screening for diabetes is recommended for all women who had a history of gestational diabetes. Perhaps again, the most important intervention that is underestimated that significantly reduces the chances of the woman and the baby to develop type 2 diabetes is breastfeeding. Breastfeeding between 6 to 9 months reduces the risk of of developing type 2 diabetes in the future for both the mother and the baby by between 50 to 75%. So we strongly advise all women who had a history of diabetes to attempt to breastfeed as long as possible. Thank you.